Hello and welcome to this COVID-19 update for you and your community here in the beautiful Bass Coast, presented by Bass Coast Health and sponsored by Wonthaggi Miners Dispensary. In this update, we'll look at the latest on surgery at Bass Coast Health, also residential care, and the new COVID Safe app. And to do all that, I welcome back CEO of Bass Coast Health, Jan Child. Hello, Jan.
Hi, Kevin.
Good to have you back.
Thanks for having me back.
And we can't have you here without the
sanitizer, very important in between.
Yes, in between.
The webs, the thumbs. Nikki Baker is on our shoulders telling us how to do this all the time.
Fantastic. All right, the latest from Bass Coast Health. And there's a lot to get through. And I'd also like, if you could, to tell us about the arrangements being made for people who want to be tested for COVID-19.
Yes, the government has absolutely committed to making sure that there's really proactive testing in the community. And you would have seen over the last few weeks that, everybody's been watching the community transmissions. They're the numbers that are really important because we know that a lot of people who were first affected by COVID were affected because they were in touch with people from international overseas trips and other things. But what we need to understand is whether the virus is actually getting out there in the community unseen. And the best way for us to do that now is to increase the testing. So there's been a real freeing up of the criteria so that really anybody with a sniffle now, no matter what job you are in, no matter what your circumstances are, if you've got a sniffle or you've got a bit of a headache or a bit of a fever or even you're a bit tired, get tested. That's part of the process of us understanding whether the COVID disease is actually out and about in our community. That's sort of silent
transmission, isn't it?
It is. Yeah. And what we know about this virus is that it's much more contagious than other viruses. It's very, very contagious. And so, just simple things like touching this table if it hasn't been cleaned and wiped down properly, touching the supermarket trolleys if they haven't been cleaned properly. If somebody else before you was using those sort of objects or using the handrail down the beach and they haven't cleaned that, they were asymptomatic and didn't know that they had COVID, but actually did have the disease and were carrying the disease even without symptoms. What they can do by touching things is to leave the droplets there. Right. And what that does is allow you or I to pick those up and transmit them.
Sure.
And
makes you want to wash your hands even more.
Well, you must wash your hands even more. You mustn't touch things. You must keep your distance. That messaging hasn't changed. It probably won't change for the next 6 months. Maybe not for a long time. Yeah. We should be continuing to do all of that stuff. But what we want to try and do now is grasp exactly how much of that community transmission there is, because we haven't been testing many people. We were just testing within those confines. So really, if you've got any symptoms at all, please present to either of our clinics at Phillip Island. And I'll give you a little hint about Phillip Island. We know that Phillip Island is less busy after hours. So we have our usual peak of people who come in for their urgent care issues between about 9 and 6 p.m. And after about 6 p.m, you can pretty much get in straight away. So for Phillip Islanders and all of the Waterline people who want to get tested, my suggestion is go to the hub and go there after hours, and you're probably more likely to get in and out pretty quickly.
So do you need to make appointments either at Wonthaggi or Phillip Island?
No,
you just turn up.
Just turn up.
Okay.
But there will be delays. Yesterday we had a number of hours delay because we were just inundated. Today what we've done is we've created a little hut out the front where for those people that just need to be swabbed, they don't need to see a doctor, they don't need to talk about any symptoms, they're pretty happy with where they're at, but they want to get one of those swabs, then we've got a little swabbing hut, and so a nurse there will take your details, write those up, and we'll do a swab and send that off. For those people that still have symptoms, so they're quite breathless, bad headache, they need some sort of treatment, then they'll go inside to our assessment clinic. And obviously for people who are really ill, we'll take them into our emergency department for a full program of assessment. So we've now got those 3 scenarios set up at Wonthaggi so that we can try to manage the demand. that little screening hut, swabbing hut that opened up today, and we're going to have that open between 8 and 6 p.m. And what we'll try to do is staff that up if we get inundated with people coming in. But it is really important in our local area that people do as much testing as they can. And what we know in the next couple of days is that they'll allow us to do some testing of certain groups. So, for example, healthcare workers are likely to be a group, even if they don't have symptoms. I imagine that there'll be a lot of Bass Coast Health staff, pharmacy staff, other medical practice staff who will want to actually get their staff proactively screened and will do that. Ambulance, those sorts of groups will all be really proactive at getting tested and again to work out the community transmission.
Let's move on to some specifics. Surgery.
Yes, so many hospitals today and yesterday started surgery, so there's some really strict guidelines around what surgery starts up, and it's obviously getting to those people who have some diseases, for example, lumps and bumps that might be cancerous that need to be taken care of, or some polyps in their bowel or things like that. So there's some really strict criteria about what surgery we can do. At the moment, we're still using our theatre complex for what we call aerosol generating procedures. So aerosol generating procedures are those procedures where droplets actually come up into the face of healthcare workers. And what we know from overseas is that that's where transmission to healthcare workers occurred. And so we've taken a very cautious approach to those procedures. So those procedures include suctioning, they include even some parts of the cardiopulmonary resuscitation, certainly intubation for theatre. All of that now happens in our theatre complex because that's the safest place for us to do that in terms of air pressure. We're busily trying to recreate some other spaces where we can create some negative pressure, positive pressure for staff so that they're not going to have those things in their face. Our biggest job is to protect our staff. We don't want our staff to be exposed during any COVID or influenza outbreak, and so we're doing some work behind the scenes to get that ready. If we can get that up and running in the next couple of weeks, we hope to be able to start our surgery then. And in the meantime, we're talking to other hospitals about how we might be able to create access for some of our patients onto other lists.
Oh, that's a good idea.
So there's a lot of work that's happening in that space. We hope to be able to come out, pretty early next week and announce which surgery we'll be doing and when.
All right, we'll have that here for you. Residential care, aged residential care is another one that's in the news a lot.
Yeah.
And I know there would be a lot of people in care and those loved ones wanting to know what's the very latest from Bass Coast Health.
Yeah, residential care is so tricky. There's been a lot of conversation from some of our leaders in the last week or so about restricting access to residential care and making sure that we understand the harm that can be caused to residents of residential care if they're locked away and they don't have access to their visitors. I guess what we've done at Bass Coast Health is not make that decision alone, but actually make that decision with our residents and our relatives. So when we first talked about how we were going to manage the restrictions in residential care, we reached out to all of our relatives and residents and said, what do you want us to do? And at that point, they said to us that they wanted to be safe. They understood that being safe meant that the less visitors that were coming into the facility, the safer it was likely to be. And certainly at that point we locked down our staffing. We said that no staff can go in and out. If you work in residential care, then you work in residential care, you don't go elsewhere. We locked down our cooks and our cleaners and all of those sort of people so that they were staying there and not going anywhere else. And what that should do is reduce the number of people who are coming in who are exposing the residents to new community transmissions. What we've done just in the last week or so is to go back out to our relatives and residents and do a check-in with them to see how they're going, because we know that it's been a few weeks and we know that it's been tough, although I have to say it's fantastic to see some of the pictures that are coming into our residents and some of the FaceTiming examples that are being seen they've adapted amazingly, but we did want to check in with our residents and relatives. And right now, they're still saying to us that they want to restrict access to our facilities as much as possible.
Understandable.
So we are holding that line at the moment. Obviously, if people are dying or if people are distressed, or for dementia clients who have relatives who need to have that connection for their own stability, we're allowing access there. But it's on a very much case-by-case basis and on conversations with the relatives and residents. And really, we're going to continue to be guided by them about how we manage access to our facilities.
That's great. Wonderful news. Terrific information. It's amazing how agile this situation is and how agile you and Bass Coast Health have to be, because things change so quickly.
Yeah. Look, 3-4 weeks ago, we were planning for a terrible scenario with, looking at overseas and looking at places like Italy and New York, where they were really feeling the pain, and even still feeling that today. And we were worried that that was going to be us. I think the physical distancing that people have done, the sanitising, the hand washing, the don't touch things, stay at home, that's absolutely meant that we are not facing that sort of crisis today.
We just got to make sure
But
it
can I
stays that
just
way.
say that, some of those countries who released restrictions and people went back to the bad habits where they weren't washing their hands, they weren't keeping distance, they started to shake hands again, they started to have a lot of communal functions where they weren't distancing even in those functions, they're now back up. And what we don't want to have in Australia is an experience where we, have done all this hard work and then, that hard work goes out the window because people relax on some of those things that are really important. So, we want to try and make sure that all of that's in place, but we also need to make sure we get back to business as usual. So, starting surgery, we need to start surgery. We need to make sure that we're maintaining some of those services and trying to do that as we still keep prepared for this winter peak. We still think, just to be clear, that there will be COVID patients in our hospital. We're still planning to have a surge of winter patients that come in, whether they be influenza or COVID. All of the modelling still tells us that we're going to be busy still. What we're trying to do, though, is to make sure that we can hold that busyness, manage all of the cross-infection transmission issues, and still provide care to our community through safe zoning of all of our care.
Speaking of safety, before you go, I'd love to get your opinion on COVID Safe, the new app.
Yeah.
Personally, I think it is awesome, brilliant, and it would be great if everybody downloaded it.
100%, Kevin. I think I signed up within about an hour of it being released. I think in our community in particular, it's really important. Like, it gives us an opportunity to really understand who's been in contact with who, so that if, you've touched that beach rail down there and you happen to get it, and then you and I have been sitting together for more than 15 minutes, then we know that we're part of that problem too. It gives us an ability to trace and track where there is community transmission occurring. And if we can do that locally, and we can make sure that most of our community are on that app, what that does mean is that the people who are tracing this in the Department of Health actually have the capacity locally to pretty much clamp down on that transmission quickly, hold people, tell people that you've been exposed, stay at home, really control the clusters of outbreaks that might occur. I think it's much more helpful for us to be really out there and promulgating the message about this app, because it does give those people in Melbourne who are doing all the tracing much greater visibility of what's happening locally. It gives us visibility to say we've now got 10 or 20 or 30 people, and what that means is that we can help plan our service delivery and our response in return. So I'm a strong advocate of the app. I really encourage you to download the app, keep your Bluetooth on, keep your phone with you, make sure that it's travelling with you so that you can do that tracing that it enables. And, I think it will save lives if we get to a point where we're having some nasty outbreaks.
And as it says, your Bluetooth has shaken hands with my Bluetooth.
Yes.
Because we've been here for this
Yes.
amount of time.
Yes.
And now we know if one gets it, the other one will be notified.
Correct.
Jan, awesome having you here. Thank you very much. And
Thank you.
just thank you so much for all the great work you do and your team.
We've got a great team.
Certainly have.
Thank you.
Jan Child, CEO of Bass Coast Health, for this COVID-19 update. Until I see you again, take care.